We're back again with the new coronavirus, now officially called COVID-19. We're sticking to our previous message of don't panic, or at least channel that panic into productive behaviors, like washing your hands appropriately. Today, though, we're going to talk about the two most likely scenarios that could play out should the outbreak not be contained. This is Healthcare Triage News. At the moment, COVID-19 is thought to be more infectious than SARS and MERS, other coronaviruses that have previously caused worldwide concern, but less likely to cause death. There are more than 48,000 cases, almost all in China at the time of taping, with more than 1,300 deaths linked to it. Many cases are probably underreported, of course. The best case scenario for this outbreak would be containment. If China can pull it off and other countries can keep those who are infected to a minimum, it's possible that we could prevent widespread infection and eradicate COVID-19 in humans. This is what we accomplished with SARS, so it's possible. But as international travel becomes easier, eradication becomes harder. Should we be unable to contain the disease and this coronavirus sticks around, still not necessarily cause for panic. This would be the fifth coronavirus that's endemic in humans, meaning it's pretty much always hanging out in the population somewhere. SARS and MERS did not become endemic. A recent article by Sharon Begley in Stat News nicely laid out the two most likely scenarios for an uncontained outbreak. The first is that COVID-19 winds up being like the other four endemic coronaviruses, which cause less serious cold-like illnesses. Should this happen, we'll worry for a few years as we track the rate of infections and make sure that it's not more severe than we think. But eventually, we won't worry about it any more than we worry about which virus is causing our latest cold. More than a third of people infected with the other coronaviruses don't even notice they're ill. This doesn't mean that some people won't become sicker, with pneumonia, for example, after contracting these coronaviruses. They do, but the rates of bad outcomes aren't usually high enough to make the news. The other more worrisome outcome will be that COVID-19 becomes a more significant seasonal virus, like influenza. That would be bad. The Centers for Disease Control and Prevention estimates that the flu has already caused up to 310,000 hospitalizations this year and between 10 and 25,000 deaths. Time will tell if the new coronavirus ends up being less or more dangerous than the flu. We don't fully know yet how bad it is. Usually the diseases that stick around tend to become less lethal. Only live hosts can continue to make more viruses. Influenza is also pretty devious in how it mutates its surface molecules from year to year to evade immune system detection. If COVID-19 is not able to do that, people's immunity to it could gradually improve. But therein lies the paradox. The outcome that has public health officials really concerned is that COVID-19 will turn into something like a disease that we have a tough time making many people worry about right now. Every year, physicians and public health officials try to get people to immunize themselves against the flu, and far too many don't. We beg people to practice proper precautions and hygiene, and still tens of thousands of people die, and many don't take influenza seriously enough. Governments and employers can help by making it easier for sick people to stay home from work. Many Americans without paid sick leave go to work despite feeling ill, and many of those work at restaurants, schools, and hospitals where disease is easily spread. The most significant defense the United States has to prevent pandemics is a solid public health infrastructure. The public has to trust it. The system also needs to be properly prepared and have resources to handle a widespread infection. And the system is currently stretched thin and underfunded. It's critical to make sure that there are enough medical supplies available, as well as necessities like food to get a community through an outbreak. Should you be worried about getting infected with viruses? Sure. Have you gotten a flu shot yet? Don't shake hands with people who are sick, and if you're sick, stay away from other people. Clean the objects and surfaces that you touch a lot. That's how you'll significantly reduce your risk from being infected with COVID-19. It'll also help you from being infected with the flu. It'll even help protect you from getting a cold. Wins all around. Did you enjoy this episode? You might enjoy this other episode on another year, another flu shot. It also helps if you like and subscribe down below. We'd also appreciate it if you go to patreon.com/healthcaretriage and think about supporting the show. Everything you might give us helps make the show bigger and better. We'd especially like to thank our research associate Joe Sevitz and, of course, our Surgeon Admiral Sam.